Welcome to NCLEX Map, the power engine that transforms knowledge into confident action. Today we explore ostomy management, one of the most complex and human-centered areas of nursing care. An ostomy is a surgically created opening in the abdominal wall that allows waste to exit through a stoma. It may be temporary or permanent, depending on disease or surgery, and aims to bypass damaged or removed bowel or bladder. There are several types. An ileostomy is formed from the terminal ileum for ulcerative colitis, Crohn's disease, or polyposis. It produces liquid stool rich in enzymes and electrolytes. Nurses monitor hydration, prevent high output, and protect skin. An ascending colostomy produces semi-liquid stool with odor. A transverse colostomy is often temporary, while descending or sigmoid colostomy produces formed stool and allows irrigation. A urostomy continuously drains urine mixed with mucus. Nurses prevent infection, maintain dependent drainage, and assess hydration. Continent ostomies like the cock or Indiana pouch allow intermittent catheterization, while a neobladder uses bowel tissue to restore voluntary urination, but needs pelvic retraining. Each type has distinct care needs that influence fluid balance, appliance choice, and patient education. Ostomies may be end, loop, or double barrel based on surgical intent. Indications include colorectal cancer, inflammatory bowel disease, diverticulitis, trauma, ischemic bowel, congenital anomalies, neurogenic bladder, or radiation injury. Risk factors for complications include malnutrition, diabetes, obesity, steroids, and prior radiation. Early complications include ischemia, separation, dermatitis, and dehydration. Late issues include hernia or prolapse. Before surgery, nurses collaborate with wound ostomy specialists to mark the ideal site while standing, sitting, and lying. Preoperative counseling on body image, appliance use, and intimacy reduces anxiety and speeds recovery. Postoperatively, the stoma should appear moist, shiny, and beefy red. Pale or dusky indicates ischemia and requires urgent action. Output varies by type and thickens as diet advances. Appliance fit must be exact, cut 1 to 2 millimeters beyond the stoma, empty when 1/3 full, and change every 3 to 5 days or when leaking. Clean gently with warm water only, avoiding harsh soaps. Protect skin using the crusting technique. High output ileostomy, over 1,500 milliliters daily, can cause dehydration, hyponatremia, and kidney injury if not corrected promptly. Manage high output using glucose saline rehydration, scheduled loperamide, and proton pump inhibitors to reduce secretions. Track daily weights, electrolytes, and urine output of at least 1,200 milliliters per day. Never use plain water. It worsens sodium loss. Teach patients to recognize early signs of dehydration such as dizziness, dark urine, or decreased output. Early action prevents hospital readmission. Scenario 1. A 58-year-old male on day 4 after rectal surgery presents with ileostomy output over 2,000 milliliters and rising creatinine. What is most important to assess? Hydration and electrolyte status. Monitor intake, output, and blood pressure. The rationale: uncontrolled fluid loss leads to hypovolemia and acute kidney injury. Early rehydration prevents further decline and supports recovery. Scenario 2. An 82-year-old with a new end colostomy develops painful skin separation and leakage. What must be checked first? Assess separation depth, drainage, and infection signs. Evaluate nutrition and glucose control. Rationale: Low protein and poor healing increase tissue breakdown and infection risk. Correct the fit, apply the crusting technique, and optimize nutrition for faster wound repair. Scenario 3. A 64-year-old with a colostomy reports bulging under the pouch and frequent leaks. What should be evaluated? Assess for peristomal hernia or prolapse. Check for pain, nausea, or changes in stool output. Rationale: trapped bowel loops may cause obstruction. Support garments or surgical consultation may be required to prevent ischemia and maintain appliance stability and comfort. Emotional support is just as important. A stoma impacts self-image and identity. Encourage open communication and self-care to boost confidence. Peer support groups can help normalize the experience and reduce stigma. Cultural sensitivity is vital. Respect beliefs around waste and involve spiritual care. Ostomy care is about compassion and restoring dignity. It's a new beginning. If this brought you clarity and confidence, don't forget to like, share, and subscribe to NCLEX Map, your ultimate guide to mastering nursing judgment. Thank you for joining us, and we'll see you next time with another evidence-based, empowering presentation.